Introduction to First Aid. First aid involves immediate assistance given to an injured or ill person using available resources until professional medical help arrives. Its primary goals are to preserve life, prevent the condition from worsening, and promote recovery. Understanding basic first aid principles can significantly impact outcomes in emergency situations. This course will equip you with the knowledge and skills necessary to act confidently and effectively when faced with an emergency. It emphasizes practical application and critical decision-making in high-pressure scenarios. Learning first aid is a civic responsibility that empowers individuals to make a difference. The importance of first aid extends beyond immediate care, as it can reduce pain, minimize complications, and provide comfort to casualties. It also plays a crucial role in preventing further injury or illness by securing the scene and making it safe. Prompt and appropriate first aid can often mean the difference between full recovery and long-term disability or even death. This introductory section lays the groundwork for the more specific techniques and conditions covered throughout the certificate program. It highlights the foundational role of quick thinking and preparedness. Principles of first aid. The core principles of first aid guide responders in any emergency situation. These include prioritizing the safety of the rescuer, the casualty, and bystanders. Always ensure the scene is safe before approaching an injured person to avoid becoming a casualty yourself. Another vital principle is to gain consent from the conscious casualty before providing aid, respecting their autonomy. If the casualty is unconscious, implied consent is assumed, allowing you to proceed with life-saving measures. These ethical considerations are paramount in all first aid scenarios. Further principles involve assessing the casualty's condition systematically and providing appropriate treatment based on the assessment findings. This systematic approach ensures that critical issues are addressed promptly and effectively. It is equally important to call for professional medical help as soon as possible, providing clear and concise information about the situation. Continuous monitoring of the casualty's condition and recording observations are also crucial. Finally, maintaining privacy and confidentiality regarding the casualty's information is an ethical obligation for all first aid providers. Assessing the situation. DRS-ABCD. DRS-ABCD is a critical acronym used to guide first responders in assessing and managing an emergency situation effectively. It stands for danger, response, send for help, airway, breathing, CPR, and defibrillation. The first step, danger, involves checking that any hazards to yourself, the casualty, or bystanders. Always ensure the scene is safe before proceeding. Response requires checking if the casualty is conscious and responsive by asking questions and gently shaking their shoulder. This initial assessment helps determine the severity of their condition and guides subsequent actions. Following response, send for help, means immediately calling emergency services, for example, 911 or 000, or delegating someone to do so. Airway involves checking if the casualty's airway is clear and open, as an obstructed airway can be life-threatening. Breathing requires looking, listening, and feeling for normal breathing for no more than 10 seconds. If the casualty is not breathing normally, proceed to CPR, cardiopulmonary resuscitation, and defibrillation using an AED if available. This systematic approach ensures all critical steps are covered in a logical order. Calling for emergency help. Knowing when and how to call for emergency help is a crucial first aid skill. Always call emergency services, e.g. 911, 000, 112, immediately for any life-threatening situation or serious injury. Provide clear and concise information to the operator, including your exact location, the nature of the emergency, and the number of casualties. Stay calm and speak clearly, answering all questions asked by the operator. Do not hang up until the operator tells you to do so, as they may provide vital instructions or keep you on the line until help arrives. This communication is critical for a rapid and effective response. If possible, delegate someone else to call for help while you attend to the casualty, especially if you are alone. Ensure the person making the call is capable of providing accurate information and understands the importance of staying on the line. If you are alone, use a speakerphone if available to communicate with emergency services while continuing to provide first aid. Be prepared to describe the casualty's condition, any first aid already administered, and any specific hazards at the scene. Effective communication with emergency services ensures that the right resources are dispatched quickly to your location. Managing unconscious casualty. When encountering an unconscious casualty, your immediate priority is to ensure their airway is open and clear. First, check for responsiveness using the response step of DRS ABCD. If they are unresponsive, immediately call for emergency help. Then, carefully open their airway using the head tilt, chin lift maneuver unless a spinal injury is suspected. Look, listen, and feel for normal breathing for no more than 10 seconds. If the casualty is breathing normally but remains unconscious, place them in the recovery position to prevent airway obstruction from their tongue or vomit. This position helps maintain an open airway and allows fluids to drain. Continuously monitor the unconscious casualty's breathing and level of responsiveness while waiting for emergency services to arrive. Check their pulse if trained and able. If the casualty stops breathing normally at any point, immediately commence CPR. Protect them from the elements by covering them with a blanket if it's cold or shading them if it's hot. Reassure any bystanders and keep them calm. Never leave an unconscious casualty unattended. Providing ongoing care and monitoring is crucial until medical professionals take over, ensuring their safety and well-being throughout the emergency. Cardiopulmonary resuscitation, CPR. Cardiopulmonary resuscitation, CPR, is a life-saving technique performed when someone's breathing or heart stops. It involves a combination of chest compressions and rescue breaths to maintain blood flow to the brain and other vital organs. Begin CPR immediately if a casualty is unresponsive and not breathing normally. Position the casualty on a firm, flat surface. Kneel beside them and place the heel of one hand in the center of their chest, with the other hand on top, interlocking your fingers. Deliver compressions at a rate of 100 to 120 per minute, to a depth of about 5 to 6 centimeters for adults. This rhythmic action is crucial for circulating blood. After 30 chest compressions, deliver 2 rescue breaths. Ensure the airway is open using the head tilt chin lift maneuver. Pinch the casualty's nose and make a seal over their mouth. Deliver a breath lasting about 1 second, watching for chest rise, then repeat for the second breath. Continue cycles of 30 compressions and 2 breaths without interruption until emergency medical services arrive, an AED becomes available, or the casualty shows signs of life. If you are unwilling or unable to give rescue breaths, continuous chest compressions are still highly effective and should be performed. Early, high-quality CPR significantly increases the chances of survival. Automated External Defibrillator AED. An automated external defibrillator AED is a portable electronic device that can analyze the heart's rhythm and, if necessary, deliver an electrical shock to restore a normal heartbeat. Early defibrillation, when combined with CPR, is crucial for improving survival rates in cases of sudden cardiac arrest. Knowing how to use an AED is an essential first aid skill. When an AED becomes available, immediately turn it on and follow its voice prompts. The device will guide you through each step, making it user-friendly even for untrained individuals. Do not delay its application once it is present. Attach the AED pads to the casualty's bare chest as indicated by the diagrams on the pads themselves. One pad typically goes on the upper right side of the chest and the other on the lower left side. Ensure the pads are firmly attached. The AED will then analyze the heart rhythm. It is critical that no one touches the casualty during this analysis. If a shock is advised, ensure everyone is clear before pressing the shock button. After delivering a shock, or if no shock is advised, continue CPR until emergency services arrive or the casualty shows signs of life. The AED will continue to guide you through the process. Choking. Adult and child choking occurs when an object obstructs the airway, preventing air from reaching the lungs. For conscious adults and children who are choking, the first step is to encourage them to cough forcefully. If coughing is ineffective, administer 5 sharp back blows between the shoulder blades with the heel of your hand. Position yourself slightly to the side and behind the casualty, supporting their chest with one hand. Observe if the obstruction is cleared after each back blow. This immediate action can dislodge the foreign object and restore breathing. Act quickly and decisively. If back blows do not clear the obstruction, proceed to 5 abdominal thrusts, also known as the Heimlich maneuver. Stand behind the casualty, wrap your arms around their waist, and make a fist with one hand. Place the thumb side of your fist just above their navel, below the breastbone. Grasp your fist with your other hand and deliver quick, upward thrusts into the abdomen. Alternate between 5 back blows and 5 abdominal thrusts until the obstruction is cleared. Emergency help arrives or the casualty becomes unconscious. If they become unconscious, begin CPR immediately. Choking. Infant choking in infants requires a modified approach due to their delicate anatomy. If an infant is conscious and choking, first deliver 5 back blows. Support the infant face down along your forearm, with their head lower than their chest, supporting their head and neck. Deliver 5 sharp back blows between their shoulder blades with the heel of your hand. Be gentle, but firm. Observe if the obstruction is cleared after each back blow. This technique utilizes gravity and force to dislodge the foreign object from their tiny airway. Always ensure the infant's head is well supported throughout the process. If back blows are unsuccessful, proceed to 5 chest thrusts. Turn the infant onto their back, still supporting their head and neck, with their head lower than their chest. Place 2 fingers in the center of their chest, just below the nipple line. Deliver 5 quick downward thrusts, similar to CPR compressions, but at a slower rate. Alternate between 5 back blows and 5 chest thrusts until the obstruction is cleared, emergency help arrives, or the infant becomes unconscious. If the infant becomes unconscious, begin CPR immediately, starting with rescue breaths. Prompt action is critical for infant choking. Severe bleeding management. Severe bleeding can be life-threatening and requires immediate attention. Your primary goal is to control the bleeding and prevent shock. First, ensure your own safety by wearing gloves if available to protect against blood-borne pathogens. Apply direct pressure to the wound using a clean cloth, sterile dressing, or even your bare hand if nothing else is available. Maintain continuous pressure. Elevate the injured limb above the level of the heart if there are no suspected fractures, as this can help reduce blood flow to the area. These initial steps are crucial for minimizing blood loss. If bleeding continues through the first dressing, do not remove it. Instead, apply additional dressings on top and maintain firm, direct pressure. If direct pressure and elevation are insufficient, consider applying pressure to a main artery supplying the area, if trained to do so. In extreme, life-threatening cases where direct pressure is ineffective and trained personnel are present, a tourniquet may be applied as a last resort. Once bleeding is controlled, Secure the dressings with a bandage. Continuously monitor the casualty for signs of shock and keep them warm while awaiting emergency medical services. Reassure them and keep them calm. Minor cuts and scrapes. Minor cuts and scrapes are common injuries that can usually be managed with basic first aid. The first step is to wash your hands thoroughly with soap and water to prevent infection. Then, gently clean the wound itself with mild soap and water to remove any dirt or debris. If the wound is bleeding, apply gentle, direct pressure with a clean cloth or gauze until the bleeding stops. This usually takes only a few minutes for minor injuries. Ensure the wound is completely clean before proceeding to dressing it. Once the wound is clean and bleeding has stopped, apply a thin layer of antibiotic ointment to help prevent infection and keep the wound moist. Cover the cut or scrape with a sterile bandage or adhesive dressing. This protects the wound from further contamination and helps it heal. Change the dressing daily, or whenever it becomes wet or dirty, and continue to monitor the wound for any signs of infection, such as increased redness, swelling, pus, or fever. Most minor cuts and scrapes heal quickly with proper care. Burns and scalds. Burns and scalds are injuries to the skin caused by heat, chemicals, electricity, or radiation. Scalds are specifically caused by hot liquids or steam. For minor burns, first degree or small second degree, the immediate first aid is to cool the burn under cool, running water for at least 10 to 20 minutes. Do not use ice, as it can cause further tissue damage. Remove any clothing or jewelry near the burn, unless it is stuck to the skin. Cooling the burn helps to reduce pain, swelling, and the depth of the injury. Act quickly to minimize damage. After cooling, cover the burn with a loose, sterile, non-fluffy dressing or plastic wrap to protect it from infection. Do not apply creams, ointments, or home remedies like butter to the burn, as these can trap heat and increase the risk of infection. For severe burns, large second degree, third degree, or chemical electrical burns, call emergency services immediately. Continue to cool the burn until professional help arrives. Monitor the casualty for signs of shock and keep them warm. Reassure them and manage pain as best as possible. Proper burn care is essential for healing and preventing complications. Fractures and dislocations. Fractures are breaks in a bone, while dislocations occur when bones at a joint are forced out of alignment. Both are serious injuries requiring professional medical attention. The immediate first aid goal is to immobilize the injured area to prevent further damage and reduce pain. Do not attempt to straighten a deformed limb or push a bone back into place. Support the injured limb in the position you find it, using pillows, rolled blankets, or improvised splints. This stabilization is critical for preventing complications and minimizing discomfort. Always treat any suspected fracture as a real one. Call for emergency medical help immediately for suspected fractures or dislocations. While waiting for help, continue to support the injured limb. You can apply a cold pack wrapped in a cloth to the injury to help reduce swelling and pain, but ensure it doesn't directly touch the skin. Monitor the casualty for signs of shock and keep them warm and comfortable. Reassure them and keep them calm. If there is an open fracture, where the bone breaks through the skin, cover the wound with a sterile dressing and apply gentle pressure around the wound to control any bleeding, without pushing on the bone itself. Immobilization is key. Sprains and strains. Sprains are injuries to ligaments, the tough bands of fibrous tissue that connect bones to each other at a joint. Strains are injuries to muscles or tendons, the fibrous cords that attach muscles to bones. Both are common injuries, often occurring during physical activity. The first aid for sprains and strains follows the RICE principle: rest, ice, compression, and elevation. Immediately rest the injured limb to prevent further damage. Avoid putting weight on a sprained ankle or using a strained muscle. This initial rest is crucial for healing. Apply ice to the injured area for 15 to 20 minutes every 2 to 3 hours for the first 24 to 48 hours. Wrap the ice pack in a cloth to prevent direct skin contact. This helps reduce swelling and pain. Apply a compression bandage firmly, but not too tightly, around the injured area to help minimize swelling. Ensure it doesn't cut off circulation. Finally, elevate the injured limb above the level of the heart whenever possible. This also helps reduce swelling. Seek medical attention if the pain is severe, the limb cannot bear weight, or there is significant deformity. RICE is effective for most minor sprains and strains. Head and spinal injuries. Head and spinal injuries are among the most serious medical emergencies, as they can lead to permanent disability or death. Always suspect a head or spinal injury if the casualty has experienced a significant fall, a blow to the head or back, or a motor vehicle accident. The most critical first aid principle is to minimize movement of the head and spine. Do not move the casualty unless they are in immediate danger, for example, fire, drowning. Stabilize the head and neck in the position you find them, using your hands or improvised supports. This prevents further damage to the delicate nervous system. Immediately call for emergency medical help. While waiting for professionals, continuously monitor the casualty's responsiveness, breathing, and circulation. If the casualty is unconscious and not breathing normally, CPR may be necessary, but extreme care must be taken to minimize head and neck movement during airway management. If the casualty is conscious, reassure them and keep them still. Look for signs of injury, such as bleeding from the head, clear fluid from the ears or nose, or changes in pupil size. Keep them warm and comfortable. Emphasize that movement can worsen the injury, so remaining still is paramount. Shock management. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. This can result from severe injury, illness, or allergic reactions. Recognizing and managing shock is critical in first aid. Signs of shock include pale, cold, clammy skin, rapid and weak pulse, rapid and shallow breathing, nausea or vomiting, and restlessness or anxiety. The casualty may also become unresponsive. Immediate first aid aims to improve blood flow to vital organs and address the underlying cause if possible. Act quickly to stabilize the casualty. To manage shock, first ensure the casualty is lying down comfortably, preferably on their back. Elevate their legs about 12 inches, 30 centimeters, if there are no suspected head, neck, back, or leg injuries. This helps to improve blood flow to the brain and heart. Loosen any tight clothing around their neck, chest, or waist. Keep them warm by covering them with a blanket or coat, as maintaining body temperature is important. Reassure the casualty and keep them calm. Do not give them anything to eat or drink. Call for emergency medical help immediately and continuously monitor their condition until professional help arrives. Prompt management can prevent shock from worsening. Allergic reactions and anaphylaxis. An allergic reaction occurs when the immune system overreacts to a harmless substance called an allergen. Symptoms can range from mild, such as skin rashes, itching, and sneezing, to severe, life-threatening anaphylaxis. Anaphylaxis is a severe, whole-body allergic reaction that can cause airway swelling, difficulty breathing, a drop in blood pressure, and shock. Common triggers include certain foods, insect stings, medications, and latex. Recognizing the signs of anaphylaxis is crucial for immediate intervention. Look for rapid onset of symptoms involving multiple body systems. For a severe allergic reaction or suspected anaphylaxis, immediately call for emergency medical help. If the casualty has a prescribed adrenaline auto-injector, for example EpiPen, assist them in administering it without delay. Follow the instructions on the device. Ensure the casualty is lying down with their legs elevated, unless they are having difficulty breathing, in which case they should sit upright. Loosen any tight clothing. Continuously monitor their breathing and responsiveness. Be prepared to administer CPR if they become unresponsive and stop breathing normally. Reassure them and keep them calm. Prompt administration of adrenaline is life-saving. Asthma attack management. An asthma attack occurs when the airways narrow and swell, producing extra mucus, making breathing difficult. Symptoms include shortness of breath, wheezing, coughing, and chest tightness. A severe asthma attack can be life-threatening. The immediate first aid involves helping the casualty use their reliever inhaler. If they have a spacer, encourage them to use it with the inhaler, as this improves medication delivery. Stay calm and reassure the casualty, as anxiety can worsen their breathing. Help them sit upright in a comfortable position, leaning slightly forward. This posture can ease breathing. Administer 4 puffs of their reliever inhaler, 1 puff at a time, with 4 breaths in between each puff. Wait 4 minutes. If there is no improvement, or if the attack is severe, immediately call for emergency medical help. Continue to administer 4 puffs every 4 minutes until medical help arrives or their breathing improves. Do not leave the casualty unattended. Continuously monitor their breathing and responsiveness. If they become unresponsive and stop breathing normally, begin CPR. Early intervention with their reliever inhaler is key to managing an asthma attack effectively. Diabetic emergencies. Diabetic emergencies typically involve either very low blood sugar, hypoglycemia, or very high blood sugar, hyperglycemia. Hypoglycemia is more common and can be more immediately dangerous. Signs of hypoglycemia include confusion, dizziness, sweating, trembling, irritability, and slurred speech. The casualty may appear drunk. If a conscious diabetic person shows these symptoms, immediately give them something sugary to eat or drink, such as fruit juice, regular soda, glucose tablets, or candy. This rapid sugar intake helps to quickly raise their blood sugar levels. Do not give diet drinks. If the casualty is unconscious or unable to swallow, do not attempt to give them anything by mouth, as this could lead to choking. Immediately, call for emergency medical help. Place them in the recovery position if unconscious. Continuously monitor their breathing and responsiveness. If they have an emergency glucagon injection kit and you are trained, administer it. For hyperglycemia, symptoms develop more slowly and include excessive thirst, frequent urination, and nausea. While less urgent, it still requires medical attention. Always call for emergency help if you are unsure or if the casualty's condition does not improve after initial treatment. Prompt action can prevent severe complications. Seizures and epilepsy. A seizure is a sudden, uncontrolled electrical disturbance in the brain that can cause changes in behavior, movements, feelings, and levels of consciousness. Epilepsy is a neurological disorder characterized by recurrent, unprovoked seizures. During a seizure, the casualty may fall to the ground, experience uncontrolled jerking movements, or stare blankly. The primary first aid goal is to protect the casualty from injury and ensure their safety. Do not restrain them or put anything in their mouth, as this can cause harm. Move any nearby objects that could cause injury away from them. This creates a safe space. Time the seizure from start to finish, as this information is important for medical professionals. After the seizure stops, the casualty may be confused, drowsy, or fall asleep. Gently roll them onto their side into the recovery position to ensure an open airway. Stay with them until they have fully recovered and are aware of their surroundings. Reassure them and speak calmly. Call for emergency medical help if the seizure lasts longer than 5 minutes, if it is their first seizure, if they have repeated seizures, if they are injured during the seizure, or if they do not regain consciousness. Providing calm, protective care is essential. Poisoning and overdose. Poisoning occurs when a substance causes harm to the body, either through ingestion, inhalation, absorption through the skin, or injection. An overdose is a specific type of poisoning caused by taking too much of a drug or substance. Symptoms vary widely depending on the substance, but can include nausea, vomiting, abdominal pain, dizziness, confusion, difficulty breathing, or loss of consciousness. The immediate first aid goal is to identify the poison if possible, call for help, and prevent further exposure. Do not induce vomiting unless specifically advised by a medical professional. This can cause more harm. Immediately call emergency services or a poison control center for advice. Provide them with as much information as possible about the substance, the amount taken, and when it was taken. If the casualty is conscious, keep them calm and comfortable. If the poison is on their skin or in their eyes, flush the affected area with plenty of cool, running water for at least 15 to 20 minutes. If the casualty is unconscious, place them in the recovery position and continuously monitor their breathing and responsiveness. Be prepared to administer CPR if necessary. Bring any packaging or containers of the suspected poison to the medical professionals. Prompt and accurate information is vital for effective treatment. Heat exhaustion and heat stroke. Heat exhaustion and heat stroke are serious conditions caused by prolonged exposure to high temperatures, leading to the body overheating. Heat exhaustion is less severe, with symptoms including heavy sweating, faintness, dizziness, fatigue, cool and clammy skin, and rapid, weak pulse. First aid for heat exhaustion involves moving the casualty to a cooler place, loosening tight clothing, and having them lie down. Give them sips of cool water or a sports drink if they are conscious and able to swallow. Cooling measures are crucial to prevent progression to heat stroke. Heat stroke is a medical emergency where the body's temperature regulation system fails, leading to a dangerously high body temperature, above 104 degrees Fahrenheit or 40 degrees Celsius. Symptoms include hot, red, dry or moist skin, confusion, slurred speech, seizures, and loss of consciousness. Call for emergency medical help immediately. While waiting, aggressively cool the casualty by moving them to a cooler place, removing excess clothing, and applying cool, wet cloths to their skin. Fan them vigorously. If possible, immerse them in a cool bath or shower. Do not give them anything to drink if they are unconscious. Continuously monitor their condition until professional help arrives. Rapid cooling is life-saving for heat stroke. Hypothermia and frostbite. Hypothermia occurs when the body loses heat faster than it can produce it, leading to a dangerously low body temperature. Symptoms include shivering, confusion, slurred speech, clumsiness, and drowsiness. Severe hypothermia can lead to loss of consciousness and cardiac arrest. First aid for hypothermia involves moving the casualty to a warm, dry place and removing any wet clothing. Replace wet clothing with dry, warm layers. Wrap them in blankets, sleeping bags, or coats, ensuring their head and neck are also covered. The goal is to gradually rewarm the body. Do not rub the casualty or give them alcohol. Frostbite is an injury caused by freezing of the skin and underlying tissues, typically affecting fingers, toes, ears, and nose. Affected areas may appear pale, waxy, or grayish-yellow and feel numb or hard. For frostbite, gently rewarm the affected area by immersing it in warm, not hot, water, around 100 to 105 degrees Fahrenheit or 38 to 40 degrees Celsius for 20 to 30 minutes. Do not rub the affected area or use direct heat, as this can cause further damage. Cover the rewarmed area with sterile dressings, separating fingers or toes when gauze. Call for emergency medical help for both hypothermia and frostbite. Continuously monitor the casualty and keep them warm and comfortable until professional help arrives. Bites and stings. Bites and stings from animals, insects, or marine life can range from minor irritations to life-threatening emergencies. The first aid approach depends on the type of bite or sting. For insect stings, example bee, wasp, remove the stinger if visible by scraping it away with a fingernail or credit card rather than pinching it. Wash the area with soap and water. Apply a cold pack to reduce swelling and pain, and monitor for allergic reactions. For spider bites, clean the wound, apply a cold pack, and seek medical attention if symptoms worsen, or if it's a known venomous spider bite. Always prioritize safety. For animal bites, clean the wound thoroughly with soap and water to reduce the risk of infection. Apply direct pressure to control any bleeding, then cover with a sterile dressing. Seek medical attention immediately, especially for deep bites, bites from unknown animals, or if rabies is a concern. For snake bites, keep the casualty calm and still, immobilize the bitten limb below the level of the heart, and call for emergency medical help immediately. Do not wash the wound. Apply a tourniquet or attempt to suck out venom. For marine stings, for example jellyfish, rinse with seawater, not fresh water, and apply heat or vinegar as appropriate for the specific species. Always call for emergency help if you suspect a serious bite or sting, or if the casualty shows signs of an allergic reaction or shock. First aid kit essentials. A well-stocked first aid kit is indispensable for managing minor injuries and providing initial care in emergencies. Essential items include sterile adhesive bandages in various sizes, sterile gauze pads, adhesive tape, and antiseptic wipes or solution for cleaning wounds. Scissors, tweezers, and safety pins are also useful tools. Always ensure your kit contains a pair of disposable gloves to protect both the rescuer and the casualty from infection. A triangular bandage can be used for slings or to secure dressings. These basic supplies form the foundation of any effective first aid kit. Beyond basic wound care, a comprehensive first aid kit should also include pain relievers, examples paracetamol, ibuprofen, antihistamines for allergic reactions, and any personal medications required by individuals in the group. A thermometer, a CPR face shield, and an emergency blanket are also valuable additions. Consider including a small first aid manual or guide for quick reference. Regularly check the expiry dates of all items and replace anything that is used or expired. Keep your first aid kit easily accessible at home, in your car, and during outdoor activities. Being prepared with the right tools can make a significant difference in an emergency. Legal and ethical considerations. Providing first aid involves important legal and ethical considerations that every first aider should understand. The Good Samaritan laws exist in many regions to protect individuals who voluntarily provide reasonable assistance to others in an emergency. These laws generally shield rescuers from liability for ordinary negligence, encouraging people to help without fear of legal repercussions. However, it is crucial to act within the scope of your training and not attempt procedures you are not qualified to perform. Always prioritize the casualty's best interests and safety. Understanding these legal frameworks is vital for confident and responsible action. Ethical principles in first aid include obtaining consent from a conscious casualty before providing aid, respecting their autonomy and privacy. If the casualty is unconscious, implied consent is assumed for life-saving interventions. Maintaining confidentiality regarding the casualty's condition and personal information is also paramount. Always act without discrimination, providing care to anyone in need, regardless of their background. Documenting observations and actions, if feasible, can be helpful for medical professionals. Remember, your role is to provide immediate, temporary care until professional medical help arrives, not to replace it. Adhering to these legal and ethical guidelines ensures responsible and compassionate first aid.